Hi, I'm Art Kaplan. I'm at the Division of Medical Ethics at the NYU School of Medicine. Well, we've all been hearing some good news about vaccines. It looks like some vaccines made by Pfizer, Moderna, may be out for early approval. And hopefully, we will face a very important moral question: who should get them first? Remember, when a vaccine comes out with early approval, it means the data on evidence for safety and for efficacy is incomplete, but it's looking good and good enough to let the FDA say, we think there should be an emergency use permission for vaccines. So you still have incomplete information that is a little bit risky in that something could still show up. It might be that the vaccine's duration of efficacy, even though we've heard numbers like 90%, isn't that good, doesn't last more than a couple of months. Or maybe it's unlikely, but there could be a safety issue that pops up after more than 2 months of monitoring the subjects. In any event, there's certainly a lot of opinion that says a lot of people are going to take this vaccine with incomplete information or worrying about safety being incomplete. We hear pretty big numbers of doctors and nurses saying, maybe 40% or bigger, that they're not sure about a vaccine. But I think if it comes out with 90% effectiveness, it's going to be something that a lot of people are going to want. So there are really two ways to think about this. First, are we going to use most of the vaccine in the US that is approved early and subsequently, as a matter of fact, that gets licensed eventually, or will it be shared internationally? A lot of people argue that it should be shared internationally, that it makes sense both from a humanitarian point of view and infection. If you have big outbreaks in Europe, you don't want them spreading back here, so you may need to share with countries that are having flare ups or outbreaks. Unfortunately, the data upon which the vaccines are getting approved is not about infectivity. It's about whether the virus will harm you or kill you. So we're getting data that says if you're vaccinated, it looks like you don't get sick, but it doesn't mean you don't shed virus. If that's true, I think the case for sharing with other countries is weaker. Morally, I think we have to protect our own people at high risk first from death, disability, hospitalization. We have to try and protect the hospital system from getting overrun given huge outbreaks. And so I think we're going to be using it domestically, and I think that's morally justified. So who goes first then if we're using it in the US? High risk people, because this is a vaccine that protects against death and disability. What you want is to take the people most likely to get harmed by the virus. Frontline healthcare workers, ICU, ER, doctors and nurses, people who work cleaning rooms, people who work in the hospital with high exposure for various reasons. They're going to have to go first, partly to protect the integrity of the healthcare system. Then we're going to see other high risk groups follow: first responders, police, people with high exposure, maybe people who are working in the food industry, handling food. They've had heavy outbreaks, maybe poor people, minority people in some neighborhoods that seems to be especially ravaged by the virus. Interestingly enough, there's a lot of consensus on who should go first. Exposure, risk seem to drive who it is. I don't think the general population is going to see this vaccine till next year, probably late in the spring or the summer. But I do think we can agree on who it is: a high risk healthcare worker, a high risk first responder, a high risk institutionalized, elderly, or disabled. They're the ones who are most likely to die. They're the ones who need protection. So, what I would argue is we're going to focus on our own in the US in the short run. We're going to focus on the high risk folks in the short run. And here's hoping that the vaccine pans out. The early reports are good, but let's hope that they stick. Let's hope that we really do have a tool that we can use to work our way out of this pandemic. I'm Art Kaplan at the NYU Division of Medical Ethics. Thanks for watching.